Today we're speaking to Dr. Kyle Munro, a critical care physician who went to Liberia as a volunteer in order to treat patients during an outbreak of Ebola. Dr. Munro, tell us a little about Ebola and explain your reasons for volunteering.
Sure. Ebola virus is a severe, often fatal illness. Without treatment, 9 out of 10 people who contract the virus die, many from dehydration, hyperbulimia from excessive vomiting, loss of nutrients due to diarrhea or organ failure. The disease was reaching epidemic proportions in some areas, so outside help was needed. The irony is that the necessary medical care is relatively simple by modern standards, and I felt a kind of moral obligation to go and ensure that it was provided. Saving lives might require as little as clean IV needles, fluids, and basic lab tests, things we take for granted in resource-rich parts of the world where they're at our disposal all the time. That isn't always the case in remote parts of Africa, where supplies can be scarce and the necessary expertise lacking.
And how did the patients you were treating respond to your presence?
Well, to give you some sort of idea of what we were dealing with, the first 2 patients I treated were a brother and sister. Both had developed Ebola symptoms, which often presents like flu, with fever and pain, and straight away they fled to the bush because they were fearful of what might happen to them if they were treated. They were found quite quickly because they were too weak to run, but even with treatment, both later died. Indeed, such was the fatality rate that 9 out of 10 people who entered our treatment facility were never seen again by their family members. So you can see what those attitudes were based on.
And is it true you had to wear a lot of specialised clothing while treating patients with Ebola?
Yes, that's correct. It's a little beyond the traditional white coat a lot of patients associate with doctors in a hospital setting. I would wear my scrubs, and then I would put on a pair of thick rubber boots that came up to my knees. After that, I had to get dressed in a bodysuit, then 2 pairs of gloves, a face mask, a hood that covered my neck, and finally goggles. The overall impression is similar to that of a spacesuit. In the tropical heat and humidity, it was suffocating. You lose about 3 to 5 litres of sweat, then spend the next 2 hours hydrating before you go back in. It does limit the level of care you're able to provide because it prevents you from physically contacting your patients, and that reduces the amount of sensory input we usually get as part of our jobs as physicians. But it also saves your life.
And is there a particular case that sticks in your mind for any reason?
Yes, one particular case involved a young girl, let's call her Emma. She was part of a small cohort of patients we had to deal with where someone in the family would test positive for the disease and someone else would be negative. And once a patient had tested negative, they had to leave the unit for their own safety. The little girl was 6 years old and she'd contracted the virus, but her mother hadn't, so I had no option but to escort her away. They were both terrified about what lay ahead of them. The girl died 4 days after they were separated, but her mother survived. I think, in some ways, this story really brings home to me just how awful things could be during this outbreak. You know, the kind of personal tragedies that people had to live through.
You're back home now. Do you think you approach your job here any differently now as a result of the work you did in Liberia?
That's a good question. I do think it's made me more sensitive to how important it is to make a real connection with your patients. One of the things we had to do for our patients in Liberia, in addition to just trying to blunt the worst effects of an appalling illness, was also to try and manage their anxieties and fears. I'd like to think that I'd been aware of the need to do that before, but now I think I understand the principle behind it in an entirely new way. And that's informing the work I do with my regular patients back home.
And do you believe Ebola is something the rest of the world should be more concerned about?
Well, I know the disease has spread further, and I'm not surprised. In a recent case in Nigeria, a man infected with Ebola collapsed at a crowded international airport. He later died, and the authorities had to closely monitor nearly 60 people he might have come into contact with. The majority of people think that Ebola is a dramatic disease that kills people in no time. The reality is that the incubation period is 21 days, and because the disease can spread from one infected person to another person via direct contact with blood or body fluids, the potential for spread outside of West Africa is there. Good infection control should prevent this happening.